Hi and welcome to my podcast, the Fertility, Motherhood and Wellness Show. True Stories with Dr. Rajeev. Through this podcast, I will be dealing with issues related to fertility, safe motherhood practices, as well as women's health. Mark Twain once said, "Age is an issue of mind over matter. If you don't mind, it doesn't matter." But friends, this may not hold true when we are talking about age and fertility. I think women are deeply interested in a conversation about fertility. Mind you, it's not a conversation just for one age group of women. Not a conversation necessarily when you're post, say, 30 or post 35. This conversation is about reproduction, about taking your own power with you and deciding for yourself. Let's start with understanding how fertility in a woman works. Every woman is born with a definite number of eggs, unlike a man who can produce sperms most of his life. The number of eggs at birth varies from person to person, race to race, but on an average, it's about 1 billion. Till puberty, she releases no eggs, but after that, the body recruits a certain number of eggs every month, say about 15 or 30, under the influence of a hormone called FSH from the brain. Out of these, only one egg would finally mature and be released around mid-cycle, and the rest will all perish. Unlike popular beliefs, one can't borrow eggs from the next month. And if one doesn't have periods, it doesn't mean that the eggs of that month have been saved for later use. The rate at which a woman loses her eggs is accelerated after the age of 30, and more so after the age of 35. I'm not going to quote figures here because, unfortunately, most data that we have are Western. And it's been shown that Caucasian women have a biological age that is 6 years lesser than their Asian counterparts. Which is probably why we see so many Western celebrities getting pregnant at a very advanced age. More than often, people confuse reduced fertility with menopause. Now, menopause happens when a woman exhausts her stock of eggs and thus does not have periods for at least a year. A woman may have reduced fertility much before the actual menopause sets in. As I said earlier, fertility starts to decrease after age 30 and more rapidly after the age of 35. The woman will first notice that her cycles are getting shorter, that is, coming more frequently. So, a lot of women come in and say, "I'm getting my periods every 20 days or 21 days. So that's what I mean by cycle shortening. And the flow during periods also has reduced. So the typical complaint would be that I normally would bleed for about 4 days earlier, but now I bleed for only 2, or I bleed for only 1, or it's just a spotting. As ovulation further reduces, her cycle length gets longer and she starts to miss her periods now. And then eventually her periods will stop. Moving ahead, let's discuss what reducing fertility means. The eggs reduce both in numbers as well as in quality. We have already discussed what reducing numbers means. What about quality? As quality reduces, two things will happen or can happen. Firstly, the probability of the woman getting pregnant naturally and later even through artificial means through that egg starts to reduce because that egg may not fertilize easily through with the sperm. Which is why women of advancing age may need to resort to IVF, because in this process we may be able to forcefully fertilize an egg. But after a point in time, even through IVF, it gets impossible. Secondly, the genetic defects in the egg starts to increase. The egg has 23 chromosomes and when it comes with the 23 of the sperm, the resulting embryo has 46 chromosomes. With increasing age, the number of chromosomes which the egg carries may increase or decrease, resulting in genetic defects in the embryo. The most common one we know of is Down syndrome, wherein the child has an extra chromosome 21 coming from the egg. While most such embryos will not attach to the uterus, some may attach and then undergo a miscarriage. Very few will grow and will be discovered as an abnormal baby during the tests done in pregnancy. How does one test to know what her fertility quotient is? The test for the quantity and the quality of eggs is called ovarian reserve testing. It is usually done by a combination of two tests. A blood for anti-Mullerian hormone, which can be done anytime in the cycle and does not even require an empty stomach. It is a simple, inexpensive blood test that has a good predictability for the ovarian reserve. However, every test has its limitations and shortcomings, which is why we use this blood test in combination with another test, which is done with the help of an ultrasound machine. A vaginal scan is done on the second or third day of periods, and through this, an expert eye can count the number of eggs which are present for recruitment that month. I've already discussed this point a little earlier. This is called the antral follicle count. The combination of these two gives a fair idea about the ovarian reserve. For those intending to delay conception, it makes sense to get these two tests done on a yearly basis so that we can chart a graph and figure out how steeply the ovarian reserve is falling and thus take necessary action. And why are we today so concerned about age and ovarian reserve and fertility? The problem is ovarian reserves are going down. To be very honest, at the beginning of my practice, some 20 years ago, of the total number of IVFs I was doing, about 10% women had bad quality eggs. And that too, these were women above the age of 35, which is understandable. Today, that percentage has risen to about 60. And many of these women are under the age of 30. I don't know if it is stress or pollution or the fertilizers in the food or bad lifestyle, but fertility for women is going down, and that's a fact. This is compounded by several other factors. A. Women for professional or personal reasons are delaying marriage and conception. I'm not saying it's wrong, but one needs to be aware of the consequences. I keep getting asked, Dr. Rajeev, when should I have my first baby? Is it too late or is it too early? There was a very interesting study done in Netherlands wherein the researchers tried to figure out when one should start having children based on two assumptions. A. How many children does a woman want? And B. Is she ready for an IVF or not? Based on the above, they concluded that in order to have a chance of at least 90% to realize a one-child family, so 90% chance of having one child, couples should start trying to conceive when the female is about 35 years age or younger. In case IVF is an acceptable option. For 2 children, start by 31. So if you're going to accept IVF and you want a 90% chance, one child, you can start by 35, 2 children, start by 31. Now, if you don't want an IVF and you want one child, you need to start by 32. But if you don't want IVF and you want 2 children, you need to start by 27. So I think that makes it very, very simple. Point B. Owing to diseases like endometriosis or any other surgery on the ovary, part of the ovarian tissue gets destroyed or lost, thus leading to diminished ovarian reserve. And C, some women who are young unfortunately have cancer, and for its treatment they must undergo chemotherapy or radiotherapy, which in turn could destroy the ovary. Thus, friends, Putting your heads into the sand and expecting the problem not to happen to you because you can't see it yet won't work. I purposely brought out this podcast to bring forward this uncomfortable truth. God made women tough because their life isn't easy, and advancing age doesn't make it any easier for a woman to complete her desire to be a mother. Going forward in a connected manner and in a subsequent podcast, I will be discussing the concept of egg freezing and how it is helping scores of women. This brings me to the end of yet another podcast episode. I hope you enjoyed listening to it as much as I enjoyed making it. Thank you for your reviews and suggestions. You're making my work so much easier and better. Love you all. If you get a chance, do look up my website www.drrajeevagarwal.co.in and the associated blog. I also have a YouTube channel in my name. Do email me on fertilitywithoutborders@gmail.com if you have any queries or if you want me to create a podcast on any topic of your choice. This podcast is available on Anchor, Headphone, Spotify, Breaker, and Google Podcasts, as well as Apple Podcast. Do subscribe on any one of them or on Apple Podcast and leave your comments, suggestions, and hopefully a 5-star rating. Looking forward to great interactions. Keep listening.